basically when a couple is having intercourse without using any kind of protection for 1 year and still is unable to conceive. We call it as infertility. But in a woman who is more than 35 years of age, even 6 months of such period and she is not able to conceive should be taken seriously. Yes, definitely infertility is on the rise. 15 to 20% of the general population is suffering from infertility. There is a rise in infertility because of increasing stress in our day-to-day lives. Women are marrying late, planning their careers and hence planning their pregnancies at a later age, sometimes crossing 30. And that definitely leads to a rise. There are other environmental factors which have led to hormonal problems like polycystic ovaries, and most importantly, in the males, the sperm counts are going down day by day because of smoking or stress. So all these factors, when they come together, they have led to a rise in the infertility cases. Yes, definitely the age of a woman has a profound effect. Every year, every passing year after the age of 30, a woman's potential to conceive decreases and it sharply declines after the age of 35. And hence the success rates of IVF also go down with increasing age. So we always advise our patients to reach their fertility specialist in time so that the earlier they take treatment, the higher are their chances of getting pregnant. Okay, the most common cause for which IVF is used, and especially in our country, is bilateral tubal block. Then there are other patients of severe polycystic ovaries who have undergone multiple failed cycles of IUI or natural contacts. Then endometriosis is one major reason, and a poor male factor, that is low sperm counts or poor motility. These are the candidates which mostly require IVF. See, ART technologies have come a long way since they were conceived in the beginning. The success rates have gradually risen, and now the success rate of IVF on an average is 35 to 40% worldwide. At Gaudium, we've been maintaining a 52% success rate for the last 3 years. Okay, now patients who have had 2 to 3 failed IVF cycles elsewhere, when they come to us, we have an entirely different approach towards them, because we try to find out at first the reason for which their cycles would have failed. We identify the reasons in many of our patients. If we require to repeat a hysteroscopy or if it has never been done in the first place, we do that. Look at the uterine cavity, eliminate if there are any causes there. And we have a special approach, a different protocol that we use for our failed IVF patients, and we have been fairly successful in these kind of patients.
Experiencing the glory of parenthood is one of the most wonderful feelings in this world, and only those who experience it can really know the joy of it. Unfortunately, some couples suffer from infertility, and if you are one of those, then in vitro fertilization, commonly known as IVF, comes as a great hope for you. It's a major treatment for infertility when other methods of assisted reproductive technology have failed. However, this medical procedure is not easy, and involves a great deal of expertise for it to be successful. Therefore, choosing the right IVF specialist and the right IVF center is very crucial. There are many IVF centers in India, but Gaudium IVF Center in Janakpuri, New Delhi is known to be one of the most promising and caring IVF and Gynae solution center in the country. Dr. Manika Khanna, one of the finest IVF specialists in India and the chief gynecologist at the center, successfully runs it along with her team members. With her patient-centric approach aimed at the welfare of the mother and the child, she is helping many couples to enjoy parenthood. This clinic is a great hope for those women who wish to experience pregnancy and motherhood. Gaudium IVF has successfully treated several patients coming here from far and wide: USA, Canada, UK, Nigeria, Afghanistan and Japan. Her achievements in her field speak volumes about her expertise and knowledge as a gynecologist and IVF specialist. Her achievements: MBBS, MD, DAGE, Germany. Founder and CEO Consultant Gynecologist Infertility Specialist, Melbourne IVF. Laparoscopic Surgeon, University of Kiel, Germany. Senior Consultant, Sri Balaji Action Medical Institute. Awarded Delhi Ratna 2008. Member, American Society for Reproductive Medicine. Member, European Society of Human Reproduction and Embryology. Managing Committee Member of Baroda Wing of FOGSI, Federation of Obstetrics and Gynae Society of India, from 1997 to 98. Professional achievements: topper throughout school and college, Best Orator Award at national level, Best Scientific Presentation Award at Gujarat State Conference in Gynae, Gold Medalist in all 3 final exams, a record till unbroken at Medical College, Baroda. Awarded the youngest upcoming infertility specialist at the Gynae Summit at Medical College, Baroda. Active practice in infertility and IVF, heading a team of experts at the International Standard IVF Clinic. The IVF Clinic is consistently giving positive pregnancy results. International exposure. Trained at Melbourne IVF Unit in test tube babies. Diploma in Advanced Gynae Endoscopy at University of Kiel, Germany. Social involvement. Worked for and given various lectures and seminars on AIDS awareness. Always treated genuinely poor patients free of cost. Presently running the innovative concept of PPF, Poor Patient Fund at Gaudium. Dr. Manika Khanna has conducted more than 8,000 deliveries successfully, and the team also enjoys an unmatched success rate of 52%, average international success rate being 30 to 35%, having treated more than 4,000 infertile couples with a record of several successful cases which were pronounced almost untreatable, but today are considered almost like a miracle. Recently, she along with her team at Gaudium IVF Center helped a 51-year-old woman deliver healthy twins. It's the first case in the history of IVF treatment where at the age of 51, a woman conceived and delivered healthy twins with her own eggs. Offering world-class infertility treatment, Gaudium is a dedicated IVF center spreading over 4,000 square feet area, making it one of the biggest IVF centers in North India. The center has the best of infrastructure that matches all international guidelines and standards, including the ASHRAE, European Society of Human Reproduction and Embryology guidelines. The doctors' team at the center continuously updates itself with the latest technologies and the equipments in the field of IVF. It offers advanced infertility treatments like IVF, IUI, ICSI, embryo freezing, egg donation, donor insemination, PESA, TESA, and surrogacy in India. This center is also the first to start psychological support counseling module called Mantrana for its infertility couples. Integrating psychology counseling with the IVF treatment, Dr. Manika Khanna makes sure that her patients go ahead with the treatment with peace of mind and not with stress. Studies have shown that IVF success rate increases if psychological counseling is integrated in the IVF treatment. The Gaudium Center has modular labs, OT and lab are maintained as clean rooms, thermal and sound insulated technology door and windows that are dust and air leakage proof, embryologist friendly design lab, complete UPS auto generator backups, latest workstations, RI systems, UK, high-end ICSI machines, international standard freezing systems, separate office space for maintenance of records, highly reputed and qualified embryologists, and pharmacy outlet. Hope is life's treasure, and it is this treasure which keeps us going even during the most difficult times of our lives. It comes with strength. It comes with possibilities. So don't lose hope if you're facing the problem of infertility. Come to us and we will do our best to adorn your world with the joy of parenthood.